I really enjoy answering your health-related questions in our Ask the Doctor segments, especially with my good friend, Dr. Freda Lewis-Hall, Pfizer's Chief Medical Officer. Now, today in our Dr. Phil audience, we have a question from Kelly. So, Kelly, how can we help you?
Hi, doctors. If one of my parents had a stroke, does that mean that I'm likely to have one too? And how do I get over the fear that it can happen at any time?
Oh, wow. Now, that is a good question, Kelly, because when a parent gets an illness or disease, we all wonder the same thing. Am I next? So, Dr. Freda, should she be worried about this?
I understand your concern and your question. My mother died of a stroke when I was young, and, you know, that's a top question. Kelly, because you have a family history of stroke means that you have an increased risk for a stroke, but in many cases, it doesn't mean that you will have a stroke. It just means that your risk is increased. So family history is one of many risk factors for strokes. And so it's important to know and to share with your healthcare team what those risk factors are. So you start with your family history, and then you want to make sure you tell them if you have sleep apnea, if you have an irregular heartbeat, if you have obesity, diabetes, high blood pressure, high cholesterol, or if you smoke. And also some medications can increase your risk of stroke. Drug and alcohol use can pump up that risk as well.
Okay, so is there anything you can do to reduce the risk? Can you curb this, push it down some?
Absolutely. So you can't change your family history. That's kind of there. But many of the other things I just listed, you can change. So you want to work with your healthcare team if you have any of those illnesses that I listed to make sure that they're diagnosed and that you're managing them as best you can. And then there are a list of things that you're more in direct control of, like if you're not in a normal or a healthy weight, you can get down to that weight and try and stay there. You can eat a heart-healthy diet, increase your exercise and activity. If you're smoking, stop. And many people don't think about managing stress or realize that stress can be a gateway to a stroke. I just made this long list of risk factors and things you can do to manage them. What we've done is to put those on gethealthystayhealthy.com so that you can go there and see a complete list of risk factors and of ways to manage it.
Yeah, so the mantra is know your risk, control your risk, and you list the factors there. So if people go there and they look at those risk factors on gethealthystayhealthy.com, that kind of becomes a to-do list. You check it off, and if you've got those, you can take action, intentional exercise, put those cigarettes down, find out what the stressors are. And I want people to understand a stressor is what puts the demand on your body, which has a stress reaction. So the stressor is the job or the demand, and your body's reaction is the stress. Mm-hmm. So sometimes you need to get rid of the stressors to alleviate the stress. Yes. And that can be done. Now, one thing about stroke, the faster you get help, the better off you'll be. So it's important to know the symptoms of a stroke, right?
Absolutely. So we're going to do everything we can to prevent it, but in the event that we cannot, fast action is important. So there's an acronym that can help, and it's FAST, F-A-S-T. So F is for face. If you think someone is having a stroke, you want to ask them to smile and to see if their face is kind of lopsided.
Okay.
A is for arm. You want them to raise their arms and see if one of those arms is weak and doesn't raise as far. S is for speech. Ask them to repeat a simple sentence. It doesn't have to be complex. See if their speech is slurred or if they're saying things that you just don't understand. And the last is T, and that is for time. Time is of the essence. Dial 911 if you think that you or someone else is having a stroke, because a stroke is a medical emergency. The longer that the blood flow to your brain is blocked, the more likely there will be damage. So you want to move as fast as you can.
Okay. Now, Kelly, you mentioned your fear of having a stroke, right? Let your fear be your motivator to cut your risk. I mean, do something about it. Don't just worry about it. You know, do something about it. Now, Freda, there is so much great information and answers to health-related questions on your website, gethealthystayhealthy.com. So we want everybody to go there.
We want everybody to go there. And again, while you're there, you can sign up for our newsletter, which will then bring some of the answers to your everyday health questions to you.
Yeah. And I believe these Ask the Doctor segments are so important and helpful. Let's do this again soon.
We can do this again soon.
All right, thanks.
Thank you.
All right, appreciate it.